Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. And this week we're going to be talking to you about conservative treatment options for scoliosis. I think everyone around my age can remember way back when, in junior high school, going through a preventative scoliotic screen. And the key there was if you could detect an abnormal curve in the spine, you could make the appropriate conservative recommendations for treatment as you're continuing to grow, because that curve could definitely increase. But what happens if you're diagnosed as an adult with scoliosis? We see that in our clinic all the time. It's not that you develop scoliosis during the adult stage. It's usually a case where maybe your scoliotic curve was at a very small angle as a child, and over time it develops into something that then can become symptomatic. This week, our medical director, Dr. Michael Marciello, is going to be talking to you about conservative treatment options for scoliosis. Take it away, Dr. Mike.
What is scoliosis? Well, we talked about, again, all the structural changes that might come on with degeneration, arthritis, degeneration, structural degeneration of our backs and our joint pains and things. But when we think about scoliosis, we really think about the spine, of course. But if I use our model and take on scoliosis as a structure, here we put the model in a position of which we so-call an S-shaped curvature, or that scoliosis means a curve. Well, how does it get that way? Well, we know in children, as Dr. Tim may have mentioned, we do it checking kids all the time, and pediatricians check our children to see if they have a curvature that develops. But when we are looking at our adults and getting into the structural changes of a scoliosis, whether it started many years ago as a teenager or it started developing a little bit more as we are older, what results in this curve? It can really vary. We have the individual discs between the different vertebrae. If they break down, we all know we get shorter, we get smaller as we get older. Well, part of the aspects of a curvature will result in getting shorter. The discs degenerate, and that would be one reason for progressive of our curvature and scoliosis. What if we had a wedge fracture or compression fracture of the bone? That means one part of the bone of the spine in its structure breaks down, the body bends towards that side, we get a curvature. But many times we don't know. People come to the doctors and say, I never knew I had scoliosis. How did that come on? Well, some people happen to notice if the curvature is starting to come in, that one side of the pelvis is coming up. So we think that we had a leg length discrepancy. Well, it might not be that you have different leg lengths, but the curvature of the spine results in one side of the hip and pelvis coming up higher, and we detect that from the back and see that one side is higher. That contributes to our aspects of structural scoliosis. So we have to look at all these structures, all these different things of helping you decide what's the best treatment. There are many treatment options, but we can't just say, I have scoliosis. Oh, do you have scoliosis? It's not the same. We may have an S shape. We may have a twist. We may have a bend. All these different things that can come on with the spine structure plays a big role in what we may do for you in the best treatment. So we want to see in the office. We want to see what is causing that potential change and how we best can handle it. We may give a brace that helps try to support the aspects of the progression of the curvature. We certainly will get some chiropractic adjustments to get some mobilization again, so maybe we need to loosen up the pelvis and get some structure relief because we're actually trying to get some mobilization. We always are going to recommend some physical therapy. We can get some exercise to strengthen the muscles of the spine and make it so that you can handle this degeneration process further. But we have to look at it. We have to touch it. We have to try to determine, are you left leg up, right leg up? Is there a roundedness in the upper back? Is it affecting your neck or just your lower back? All these things can come on because it's such an intricate structure with many, many different moving segments. So when you think about scoliosis and think about curvature, we really want to make sure you come into the office so we can get a good look to decide what is the best treatment. And once we can decide on what that treatment is, then we follow it through to get you feeling better. You may have pain, you may develop more arthritis, you may just not feel like you're stiff or you're achy. We talked about maybe the flexibility as last week's discussion. You can get tighter, no question, in your muscles because the pelvis gets shifted. All these things come on when a person has degenerative curvature or degenerative scoliosis. Come on into the office. We want to take a look at it. Give us a time to make it so we can understand what's causing your troubles, and we'll do the best for you. Here at Maragal, we're going to make sure the group of us and the team can all have their input to get you better. Talk to you next week.
That was great information, Dr. Marciello. I hope you all now have a better understanding on the conservative treatment options for scoliosis. At Maragal Medical, we take a unique perspective when it comes to patient care. We're an integrated medical clinic where we combine medical care, chiropractic treatment, physical therapy, and have a special interest in regenerative medicine and integrated nutrition to make sure each and every patient gets the best care possible. And the key to all of this is making sure that you get to the root cause of the patient's problem. As a full-service integrated medical clinic, we take most insurances. If you like the information you saw today, please subscribe to our YouTube channel. More information can be found on our practice on our website at maragalmedical.com. Our health is our most valuable asset, and you should be able to access that asset each and every day without limitation by taking a full person approach, mind, body, and spirit. At Maragal Medical, let us guide you towards a path to wellness. I hope you enjoy your week. Have a great day, everyone. See you next week.